number of things that we're doing and that we've been able to advise schools, and I know that schools are undertaking their own risk assessments and looking at where they can put actions in place that actually help children and their families to socially distance and to reduce the amount of contact that they'll have. So that's things like reducing the number of pupils that might be in a class or a bubble of pupils. It's about staggering start and finish times at school, so you reduce the number of people that might come into contact at those times. Obviously putting in markings to help with social distancing, staggering, break times and lunch times, so all those things that can keep contact to a minimum. And also it's very important that schools follow the general advice that we give everybody around COVID, and that it's still really important to wash your hands for those 20 seconds or to use hand gel if you can't get soap and water. If anyone has symptoms of COVID, they don't come to school. If a child becomes ill whilst they're at school, then teachers have very good guidelines that they can follow, that they make sure that children get home as quickly as possible and as safely as possible. So I think it is safe for children to go back to school. The chief medical officers from all 4 UK countries have looked at the evidence around children and COVID, and they've concluded that children are much less likely to get COVID infections. If they do get COVID, they are much less likely to have a serious disease. They usually have very mild symptoms and they generally recover very quickly. We've also got to look at the pros and cons of children being in school and not being in school. And we know that if they're not in school, that's really not good for their general well-being. So getting back to school is important for them to meet their friends, to get back to learning and back to the things that are going to promote good health and well-being.